Alright, everybody, we are going to continue talking about fractures or bone repair. So we left off our last video talking about bone modeling, so where we are just growing the bones in diameter. So for fractures, we are going to be looking at something called bone remodeling a little bit more. Right, which is similar to bone modeling, but in remodeling, instead of resorbing or destroying that older bone kind of in the center of that cavity, so coming back to this previous slide from our last video, so instead of breaking down that tissue in the center and then building new tissue on the outside specifically so that we get a larger and larger diameter, for remodeling, the resorption of old or damaged bone tissue is going to take place wherever that damage has occurred. So that can be anywhere within that bone. So it's not specifically moving in that direction outside and slowly getting bigger and bigger. It's just going to happen localized in one specific area where there has been some sort of injury or just older tissue. All right. So for fractures and bone repair, we're going to talk a little bit about the different types of fractures and then go over the steps involved in repairing the bones after they've been damaged. All right, so starting out with different types of fractures, as you can see, we have a lot of different types of fractures. So a fracture is the official term for a broken bone. So a lot of people think that a break and a fracture are different, but fracture is just the general term for any sort of injury to the bone. So this can be a complete break in the bone, or it can be just a partial damage to that bone. So that's what most people think of when they hear the word fracture, is just like that little bit of damage without completely separating two halves of a bone from each other. Bones are going to heal regardless of whether or not they are treated by a medical professional. They may not return to their initial proper anatomical position or anything like that unless there is a medical professional helping out to make sure the two damaged ends of the bone are connected to each other properly and everything's in the proper position. So it is really important to seek medical attention in the case of any sort of fracture or suspected fracture, so that that bone is restored to as close to its previous state as possible. That helps speed up the healing process and stuff like that. So really, really important to get that medical care. All right. So there are a couple different ways that we can classify fractures. So first off, these first two images over here, panels A and B, these are talking about different types of reductions. All right, so we've got an open and closed fracture over here. So, so an open fracture is going to require surgery so that the pieces of the bone can be put back together in alignment from each other. And so as you can see here in this open fracture over here, this one piece of the bone, it's punctured through the leg, and so that's not going to move itself back into its natural position very easily or at all. So that does require surgical help to kind of get these two ends of the bone aligned together, whereas that closed fracture, also known as a closed reduction, this is not going to require surgery necessarily because the bones, the two ends, are already pretty close to their natural position, and so just kind of giving that some support and allowing that bone to undergo its healing process all on its own is going to be very, very beneficial without requiring that surgery. All right, let's talk about some of these other types of fractures. So next up in panel C, we have a transverse fracture. So this is going to be some sort of break that happens straight across a long bone in that transverse plane, which again goes side to side, giving us a top and a bottom portion of the body, or the bone in this case. So that's just that straight across break. Next up, we have this spiral fracture. So this is when bone segments, so either end of that bone, are pulled apart in a twisting motion. So that's where that spiral term comes from, is these are done, this is pressure put on the bone that twists it and causes that break to happen. Our next one, the comminuted fracture. This is going to be when we have multiple smaller breaks in a particular region of the bone. So this is going to result in some smaller pieces of bone being broken off between two larger segments. Those smaller pieces may or may not be able to get realigned with the bone. Those may have to be surgically removed, and then just let that bone rebuild itself, remodel itself without those pieces. It depends a lot on how big those pieces are, which bone has been broken, how many pieces are there, are they causing potential damage in other areas of the body where that break happens. So there's a lot of factors that go into determining how exactly to treat this style of fracture. The next one over here is an impacted fracture. This is usually going to result from some sort of compression. So like jumping onto a hard surface is going to compress a lot of parts of your body, and too much compression can cause a break. And so this is where we have one fragment or one section of the bone is driven into the other, causing a breakage between the two, because there's just going to be so much pressure and compression put on that one area that it is going to cause the bone to break. Next up is a green stick fracture. So this is a partial fracture where only one side of the bone is broken. So this isn't a complete break all the way across the bone. We just have a partial break. So these are going to heal themselves up pretty effectively with just a little bit of medical support. And then over here we have an oblique fracture, and this is going to be any sort of break that is not happening at a 90-degree angle. All right, so that transverse fracture over here, that's happening at basically a 90-degree angle to the bone, whereas the oblique fracture, it's not happening straight across in that transverse plane, it's kind of at an angle. All right. Okay. So those are our different types of fractures. So let's talk about how these fractures get repaired. So when that bone initially breaks, that's going to damage the blood vessels in there, just like any other injury to blood vessels. They are going to get torn by that fracture, and they are going to release a lot of blood into that space within that bone. So remember, we have that periosteum layer kind of encasing all of this bony tissue, and so that's going to trap all of that blood in there, forming the structure called a hematoma. These are sometimes commonly referred to as blood blisters. If you have ever pinched your finger or something like that in something and gotten that really, really dark blood-filled blister thing, that is a hematoma. So we can get those in our bones too when they get fractured. All right, but much like any other damaged blood vessels, this blood is going to begin to clot to help seal off those vessels, and that hematoma is actually going to help out a little bit. So that's going to help keep everything clotted in there, and that disruption of blood flow is going to cause the death of those bone cells around this fracture. So all of the cells in this area are going to die off, along with all of these blood cells that are getting left out of the actual vessels. Within about 48 hours after a fracture happening, so this doesn't take too terribly long, but the chondrocytes from the endosteum layer, they're going to create what we call a internal callus. So it's going to be inside of those sections of bone. They're going to secrete a matrix between the two ends to start helping to reconnect those and give a template, that framework again, to rebuild off of. And then further out from there, there's going to be more chondrocytes as well as osteoblasts that are going to start forming this external callus that surrounds that outer layer and the outer edges of that particular bone. This is going to, again, have that hyaline cartilage template that we can build off of and slowly replace with that bony tissue. Both of these calluses work together to start solidifying this fracture and stabilizing it so that the two halves of the bone don't keep moving, so that we can keep rebuilding that tissue. The blood vessels can start to regenerate and stuff like that, so we really want to get that fracture stabilized as quickly as possible. This is why sometimes if people don't get into a doctor fast enough after a broken bone, then sometimes that bone has to be rebroken and set properly so that we actually have that healing done correctly, and this process has to start all over again at that point in time. So if you ever have a suspected broken bone, get medical attention as fast as you possibly can. All right. So that process, these calluses are going to form again within a couple of days usually to really help stabilize that. The rest of the healing is going to take several weeks though, and again, bone is going to regenerate pretty effectively, especially versus cartilage. Cartilage does not regenerate very well. It can a little bit, but not as well as bone does. So we're going to stabilize that fracture first, and then slowly over several weeks, the osteoclasts are going to reabsorb and get rid of all of that old, damaged, dead bone tissue now. So they're going to get that out of the way so that we have space to start rebuilding that bone tissue. Those osteogenic cells, so those housekeeper cells, or sorry, not the housekeeper cells, the stem cells, they are going to differentiate into osteoblasts so that we can start building that new bone tissue in here. So we're going to start building off of that callus with all of that matrix from the cartilage template in there. We'll start building off of that in there with those osteoblasts. This is going to be endochondral ossification again. So we talked about that in the last video. So we're building off of that hyaline cartilage template and slowly replacing that cartilage as those chondrocytes slowly die off, as they get sealed off from nutrients and stuff like that. And so as that bone growth happens, then we really start to shrink that callus as we're filling in all of that matrix and stuff like that. And so those calluses will slowly come together and form this one area of that bone so that this isn't separate compartments at the end result, because we don't want those separate compartments in the end. We do want that all to fuse together, just not immediately. All right. So as those calluses joined together, compact bone is going to replace spongy bone at the outer edges of this fracture. So again, out here, surrounding that medullary cavity, there can be this slight swelling that remains on the bone for quite some time. That can be anywhere from a few months to several years after an injury. It really varies from person to person a whole lot. So sometimes there can be evidence on x-rays and stuff of old broken bones in some people, but not always. So that swelling's going to be there for a little bit. This bone regrowth takes a long time, but that bone will all regrow, refill in that compact and spongy bone tissue. It just takes several weeks to do that. And it requires, again, breaking down that old dead bone tissue, getting rid of that, getting that cartilage template in, and then slowly building off of that cartilage template to replace all of that cartilage with bone tissue. All right, so that's fractures. The next video covers exercise, nutrition, hormones, and bone tissue. And in that video, this is actually one that I recorded probably about a year ago when I did things just a little bit differently. So there's a couple things at the beginning of the video that aren't really going to be relevant right here. But that video is still based off of this exact material. And I'm just in the interest of time, decided to reuse that older video. But we will move on to talking briefly about the axial and appendicular skeletons and then articulations.